When speaking to primary care physicians about PAH, what are the most important key messages?
The primary care physicians really play a critical role in helping to identify patients with PAH earlier and then helping to co-manage them once they're referred to specialty centers. We've learned from very recent data that there is still a very long duration of time from the onset of symptoms until the diagnosis. We're just not diagnosing this as early as we should, and we'd like to diagnose PAH earlier before more irreversible damage is done to the pulmonary vasculature. So primary care physicians are really critical in having that heightened sense of suspicion to start evaluating a patient for PAH. It's a daunting task. The symptoms of PAH are very nonspecific: shortness of breath, chest pain, lightheadedness, things that primary care physicians see all the time. And of course, PAH being a rare disease means that the primary care physician is not going to go searching for it right away. So I think it's important for primary care physicians to do the usual evaluation they would in such a patient. But, for example, if a patient has shortness of breath that they thought was asthma and doesn't respond to inhalers, then perhaps they should start looking for other potential causes like PAH. The echocardiogram is a good initial test to get an idea of whether or not pulmonary hypertension is present, and it might be an appropriate test for a primary care physician to order in a patient who is not responding to therapy or doesn't have what they thought was the etiology of their PAH.